Sponsored by New Orleans Distillers, creators of fine spirits and liqueurs. Through dedication to science, art, and passion, blends of tradition and flavor emerge. For you, always locally crafted. New Orleans Distillers, classically Southern.
Tonight, the jobs report is out and unemployment is down. Virgin Galactic is selling seats for outer space for $450,000 a seat. But the good news is there's no $25 per bag charge. And Joe Biden wants half of all autos sold by 2030 to be battery powered. So for those of us who forget to plug in our iPhones, what's going to happen if we forget to do that to our cars? That and more tonight, all on Wall Street Wrap-Up. Hi, and welcome to Wall Street Wrap-Up, and I hope your week went well. I'm Andre Laborde. Our goal is bringing Wall Street to your street for today, Friday, August the 6th, 2021, and to get you ready for the week ahead. Now, tonight, we're going to be talking with Warner Thomas. As president and CEO of Ochsner Health Systems, Ochsner has over 130 locations in the southeast region of the country and the state of Louisiana's largest private employer with over 26,000 employees in Louisiana alone. And last year, they had revenues of over $5.9 billion, and it's growing substantially. Warner Thomas is going to be with us in just a minute. But first, how did the markets do this week? And by the way, all three indexes ended up higher for the week. Well, the Dow Jones Industrial Average ended the week up at 35,208, up 149 points for the day, and up 0.75% for the week. And the S&P 500, they closed today at 4,436, up 7 points for the day and up 0.9 point for the week. And finally, the NASDAQ, they finished the week at 14,835, down 59 points for the day, but they were up 1.1% for the week. The Dow and the S&P 500 set all-time highs with record closes, and analysts at Raymond James and Citigroup have raised the price target of Home Depot to now $375 a share. And J.P. Morgan raised Dow Chemical to a buy with a new price target at $75 a share. And Wolfe Research has raised the tech company Okta to a strong buy with a new price target at $295 a share. Well, my guest this evening is the president and CEO of the Louisiana's largest private employer. Last year, Ochsner Health Systems had revenues of over $5.9 billion, and as I mentioned earlier, growing substantially. With 130 locations around the region, Ochsner is also a teaching facility with an academic center for training physicians in the state of Louisiana. My guest tonight is Warner Thomas, and he's here with us now. Hi, Warner. Welcome to Wall Street Wrap-Up.
Great to be with you tonight.
You can't turn on the news right now without hearing about the new Delta variant of the variant of COVID. You're in the Gulf South in a number of different states. What are you seeing in your health centers?
So right now we're in what I would call the fourth surge of COVID. The first one happened here in the greater New Orleans area back in March and April of 2020. This has evolved from being a pandemic to being a pandemic of the unvaccinated. More than 90% of the folks that are in our hospitals are unvaccinated, and it really is a concern. And certainly, we have a vaccine now that's safe. The problem we have is we don't have enough people vaccinated, and the state of Louisiana is just one of the lowest in the country as far as vaccination rates.
Warner, when we hear about vaccinations, we had started to hear mixed messages. And when I say about mixed messages, I mean that we had been told that if you're vaccinated, you will not be either receiving or being able to give the COVID virus. Is that the latest that we know of, or is there new information? Because just recently, the CDC is coming out with information about how even vaccinated may have to be masked now while indoors, let's say in government buildings and such.
So, once again, COVID has evolved, right? And now we have the Delta variant here in Louisiana. About 90% of the cases in North Louisiana are the Delta variant. About 80% of the cases in South Louisiana are the Delta variant. Now let's go back to when the vaccine was identified. When it said it's about 95% effective, which means even if all things, going successful, about 5 people out of 100 are going to get COVID, even with the vaccine. But remember, 95 are not going to get COVID. With the Delta variant, we've seen that it's slightly, less effective with the Delta variant. But once again, it is still significantly effective against Delta and the original strands compared to not being vaccinated. So just to give an example, in our hospitals today, as I said, over 90% of the folks that are in our hospitals are unvaccinated. The vaccine works. It is keeping thousands and hundreds of thousands of people out of hospitals, and well. But what we're seeing now is really the pandemic of the unvaccinated.
I'm wondering too if when because right now it's being put out. I'm talking about the vaccine is being used in an emergency status and still has not been yet approved by the FDA. And I know that. I don't know the time frame, and this is something that maybe you might know as far as like just how long until. I think once. Do you think, or I'll phrase it as a question? Do you think once it's then approved by the FDA, those percentages of people that you're seeing coming into your hospital with COVID, all right, do you think that will become will then be more susceptible to be getting that vaccination, that they're waiting for that FDA approval, or do you think that has nothing to do with it?
I think there's some people that are waiting for the FDA final approval. I think there's some people that are reading all of the misinformation that's out there on social media and in other news outlets that's frankly just wrong. There are things that are flying around on social media around fertility, things that are flying around on social media about things that are being injected in people as part of the vaccine. That is simply wrong. It's incorrect. It's not true. So what I would encourage you to do is go to reputable sources, go to the Ochsner website, go to the Mayo Clinic website, go to the CDC website. Places that and don't get all of your information off of social media, because frankly, a lot of that information is not correct. And trust me, if there were really issues, we would not be giving vaccine to folks. 60 medical societies, 60 different medical societies this week came together to say the vaccine should be taken, it should be mandated. You would not see that if there was any issues or any concerns about safety with the vaccine. I don't know when it's going to come off the EUA. I don't have that information, but I can tell you that it's safe. Our physicians have looked at all of the data. They feel it's safe, and we're encouraging everybody to get vaccinated.
Are you seeing now like a complete return prior to March of 2020 of patients coming in and receiving these elective surgeries and these elective type of procedures needing to be done?
Just starting this week, this last week of July 2021, we are now having to push off some elective surgeries. And at Ochsner Lafayette, generally, we've had to shut some ORs because of lack of staff, because we have so many staff that are out on quarantine. So, these are joint replacements. These are heart procedures. Certain procedures that are going to require an inpatient stay because we have so many COVID patients that we're having to postpone, some of those elective surgeries. The other issue for Ochsner is we're the largest transfer center in the region, in the Gulf South. So we take cases and patients from all over Louisiana, Mississippi, Alabama. And frankly, we've had to turn some of those transfers away because we don't have enough folks to take care of the folks that need to be transferred to us. People that are having strokes, that are having other issues that need to come to Ochsner for our care, and we can't take the transfers because we have too many COVID patients. So we are in a situation today where folks that are choosing to be unvaccinated are driving up the number of folks that are in hospitals, and it is impacting others who are not vaccinated that need other medical care, or who are vaccinated that need other medical care.
Mm-hmm. Are you seeing also other types of problems that may be occurring that that is a recipient of this COVID, and here's what I'm thinking of. I'm thinking of maybe opioid abuse or depression. I'm thinking of suicide. I'm thinking of other types of things that we automatically don't immediately think of the symptoms that come from a COVID, but are definitely related to what's been happening the last 18 to 20 months.
Yeah. Well, one of the things we hear a lot about is, well, there's going to be a lot of side effects from the vaccine, and I don't know what the ongoing impacts of getting the vaccine are. So here's what we do know. We do know that we have not seen material side effects from folks that are taking the vaccine. Today, we have 548 patients in our hospital with COVID. We have 0 that are in the hospital from side effects or issues in taking the vaccine. 0. So that we do know. The other thing we do know is folks that get COVID, even a more mild or moderate case of COVID, about 20 to 30% of them have ongoing health issues of some kind. Fatigue, headaches, respiratory issues, neurological issues. And these things are happening, each and every day. So, without a doubt, the ongoing medical issues or chronic disease issues associated with getting COVID significantly outweigh any risk in getting the vaccine.
The baby boomers are now going into their 60s and they're also into their 70s. Are you having a more of a greater amount of patients coming in that are at that age of their 60s and 70s that are experiencing these kind of conditions?
So the interesting thing is the demographics of our patients coming in with COVID have changed dramatically from last April and March of 2020. So if you go back to March, April of 2020, May of 2020, about 10 to 15% of the patients coming to our hospitals were folks that were 50 or younger. So about 85 to 90%, 50 and older. That's not what we're seeing today. Today, what we're seeing is about 40% of the people coming to the hospital with COVID are 50 and under. Why is that? Well, one, the Delta variant is, impacting, even younger populations. Two, folks that are over 65 have a much, much higher vaccination rate. So the fact that they have a higher vaccination rate is indicating we're just not seeing as many people 60, 65, 70, 75 coming to the hospital because they've taken the vaccine and been protected. So it definitely is disproportionately now. We're seeing a much younger population compared to what we saw, 14 or 16 months ago.
How about with younger people? And when I talk, Warner, when I talk about younger people, I'm talking about 8-year-olds, 10-year-olds, 12-year-olds, let's say up to the age of 17 or 18, those that are in grade school. Because the question right now that you're hearing a lot about in the news is, should or should not school children be masked? And unlike last year where they had to be couldn't even go to school, now at least they're saying that, okay, you can go, but you have to be masked. Is there any latest data on whether or not a child should be having to wear masks?
Yeah. So I talked to our chief medical officer and our infectious disease specialist today about this. So positive thing, we're not seeing a huge escalation in the number of kids coming into our hospital. We're seeing some, but it's not as significant as what we're seeing in adults. Our position is we do think, kids should be masking, given when they go to school, at this period of time, given this fourth surge. We think that's a way to mitigate, spread. Once again, we know that that's more challenging, but we think that is definitely prudent. And we also think it's prudent that kids should be going back to school. We think it's important for them to be in school. It's important socially. It's important from a learning perspective. We also think masking is the appropriate thing to do.
I understand. What's Ochsner's policy on their staff and employees on vaccination? Is it a mandatory or is it a highly suggested?
So I would say it's very, very, very highly suggested. We have not mandated the vaccine. We will mandate it when it comes off the EUA. There's been some concerns about legal actions or legal challenges if we go down the road to mandate it while it's on the EUA. So we have held off on taking that step. We certainly will do it when it's off EUA, but in the interim, we are strongly encouraging those all of our employees to be vaccinated. And for those that are unvaccinated, just starting in the next week or so, they'll be having to wear a special mask, what are called N95 masks, which are more protective. They'll also have to have weekly testing. So we have modified our approach to folks that we employ that are unvaccinated.
And I totally understand what you're talking about, because I've talked to a number of employers, and their biggest concern, and I'm not talking about those in the health industry, I'm talking about anything from hamburger stands all the way on up to public companies. Their biggest concern is the liability aspect of being able to mandate something prior to having it being approved by FDA while it's still in the emergency status. And if you're just joining us, we're talking with Warner Thomas. He's the president and CEO of Ochsner Health. We'll take a break, but don't go away. We'll be right back. Welcome back. We're talking with Warner Thomas. He is the president and CEO of Ochsner Health, the state of Louisiana's largest private employer. When you would watch the news and they would have the death rate of those that died, well, the way it would be phrased was COVID deaths. Were those deaths from COVID, people due to COVID, or people who died that had COVID? Because it could be two different things. Let's say if you had a heart attack, but you had COVID, would that be listed on the news of those registered numbers of fatalities?
Yeah, I don't know exactly how they identified all of those when they report in the news, but I know that normally it would be identified that someone that had a heart attack that was tested and had COVID. It would not be a death from COVID. I think it's really viewed as somebody who had COVID and then, passed either from complications or conditions that were related to the COVID-19 virus.
I understand. Oh, okay. Yeah, because especially I understood like in New York, New Jersey, and those in the New England areas, that was a question that was being brought up before, because it also happened that deaths due to heart attacks were dropping, and deaths due to other type of just normal things that would occur to a person that would die of natural causes, those were dropping, but the COVID deaths were rising. So that's what I was just curious on something such as that.
I would say, last year we saw, the number of, cancers we diagnosed, the number of strokes that we cared for in, early to mid, 2020. It's not like, cancer is going away or strokes are not happening, but I think that the amount of deferred medical care was significant in 2020.
What about when Ochsner is going into other states and working with other hospitals, and I'm assuming either doing a partnership or maybe the term should be an M&A, a mergers and acquisitions. Do you find that the cost savings of having from bulk is the best reason why going and merging with other hospitals from other states?
Yeah. So I think, we've had several partnerships we've created over the past, decade plus, and several organizations that have joined us. And really, it starts with, is there alignment on culture? Is there alignment on a view of the future? It's usually multi-pronged. I will say, in all the mergers and all the partnerships we've been involved, we've grown services, we've improved services, we've grown the workforce and expanded the presence of that organization in the market that we've been involved. So it's, there's a number of reasons why people do it, but ultimately it's to provide better healthcare in their community, expanded healthcare in their community, and to retain more people locally. It isn't to bring more people to New Orleans, to our Ochsner Medical Center. It's to grow services and keep more people local, and that's really been the philosophy and principle around our partnerships.
I understand. What about, when you go to different businesses, you go to almost any business and you'll see a help wanted sign. Well, in your kind of business, it's such a specialized field. And even before 2020, in 2019, 2018, and prior, there was always, I know, a shortage of nurses. What are you looking at now with are nurses, doctors, other types of specialists? Are you having problems of finding positions to get those filled?
Yeah, sure. It's so if you looked at in 2019 going into 2020, I would say workforce is in our top 3 to 5 issues. Sitting here today, 2021, workforce is probably our number one issue. And you know, physicians are, we actually do generally pretty well in recruiting physicians, nurses, respiratory therapists, radiology technicians, other clinical areas, medical assistants, LPNs, all of these disciplines, we have huge shortages and huge needs.
Today, you see a lot more, and I'm thinking of pharmacies that are opening up, that are expanding their different types of specialties to not just fulfilling prescriptions, but I'm thinking of things like CVS or Walgreens, or let's even talk about Amazon or others. Are companies that are doing things, Teladoc, okay, are they looked upon as partners, or are they looked upon as competition for hospitals?
Yeah, I think it's a great question. I think it really depends on the entity. Certainly, I view every day we're in a battle to maintain the loyalty of our patients and the relationship with our patients. So, in addition to doing amazing things from a clinical and quality perspective, which we have to do all the time, we have to make it easier. We have to be more connected to our patients. Last year, Oxford did almost 640,000 online appointments. No phone calls, no waiting. You get online, you book the appointment when you want to come and see the physician that you want. I do think that there's going to be new disruptors like Amazon, and certainly CVS has made big investments in bringing minute clinics and expanding services in their stores. They're not going to build hospitals. They don't want to be in the hospital business. They want to be in the outpatient and ambulatory areas. And so, yeah, I think in that area, we're going to continue to have new competitors and new challenges. And that's why you see Oxford investing very significantly in outpatient areas and clinics and in digital medicine tools, which we invest, tens of millions of dollars in our digital medicine area every year.
A couple of weeks ago, we had Ed Renzi on, and Ed was the former CEO of McDonald's. And for our viewers, well, what does hamburgers have to do with healthcare? Besides maybe cholesterol, but he said one of the things about McDonald's was that you wanted to know whether you lived in Bangor, Maine, or Palm Beach, Florida, or Santa Fe, New Mexico, or New Orleans. You want to know you're going to get the same kind of quality if you see that brand name you can pull in. So I would imagine too, as far as like with Ochsner.
And that's really important, and that's why our information technology platform, we bring that to all of our partnerships. We want to have consistency across, all of our regions that we operate in. I mean, Oxford and Lafayette General, which joined us last year, will be coming on our information technology platform and be able to use all the tools that we've built in that platform. So yeah, it's really important that people want that consistency, and they want to have a common experience. It is one of the challenges in healthcare, kind of going market to market. But once again, it's something we're committed to at Oxford, to have that consistency, to make it easier for people, to reduce friction, and to be more connected to them.
As you're on the front lines, you're saying in the world of healthcare, we've all used the term, modern medicine is moving so fast. Well, again, speaking of a previous guest, I had biographer Walter Isaacson on, and he has just written a book called The Code Breaker, on how Jennifer Dauda was able to use RNA to gene edit a specific ailment, disease. Where do you see medicine in the next 5 or 10 years?
So I think genomics is going to play a big impact on that. We have a phase 1 trial program at Oxford in our cancer area, the only one in the state, where we're able to sequence folks' genomes to make sure we can target the right chemotherapy or other drug treatment, for the specific tumor or type of disease that patient has. I think it's going to continue to grow and expand in the neurosciences area, and also we have genomics projects which I would consider more preventative, where we identify certain genome sequences that indicate that you could have a higher susceptibility to cancer. So we can increase the surveillance around colon cancer screening, breast cancer screening, to make sure that we are, increasing that surveillance to catch something earlier. So that is part of where you're going to see medicine go, but also the digital tools, the digital connectivity, making it easier for people to connect with us is going to be a big focus across all health systems. And I think you'll see those tools continue to develop and grow in the coming years.
Thanks. Warner, I got a lot more questions. Every time you respond to something, I think of 5 more different questions. I hope you come back. Hope you join us.
Would love to. Would love the opportunity, and thanks for having me today.
And thanks a lot, Warner Thomas. So, in other business news this week, the economy is strengthening as the Labor Department today released their monthly jobs report. The U.S. economy added 943,000 jobs last month, and unemployment rate fell to a 5.4%. Well, if you've got a question about finance or a comment about the show, we'd love to hear from you. You can always write us at andre@wallstreetwrapup.info. Keep it pithy or concise. We'll be glad to answer your questions. And now for a look ahead for next week. But first, what year was the first ever website published? We'll have that answer in just a moment. What year was the first ever website published? The answer is 1991. Short for the World Wide Web, or WWW, it's a graphical interface for the Internet that was first introduced to the public on this day, August the 6th, 1991. The World Wide Web is 30 years old today. Well, get vaxxed or get axed. A message went out today to all the thousands of United Airlines employees today announcing that as of the end of September or October at the latest, all of the employees of United will have to be vaccinated unless for religious reasons or be fired, which happens to be maybe a great segue about United Airlines, because next week we've got a great show for you. Our guest just stepped down just 2 months ago as the CEO and chairman of the board of United Airlines. Oscar Munoz ran one of the largest airlines in the world. How do the lockdowns affect the travel business, and what does he see for the road ahead? And more importantly, are the seats getting smaller or my hips getting wider? That and more. We're going to be talking with the former CEO and chairman of the board of United Airlines, Oscar Munoz. And also coming up in the weeks ahead, we've got some great shows for you and some great guests. We repeat the show on Sunday mornings, but the best way is to set your DVR so you'll never miss a show. And that's our show for tonight, for Friday, August the 6th, 2021. I hope you enjoyed it. My thanks so much to Warner Thomas for joining us, but also this evening, my special thanks to you for allowing us into your homes tonight. Remember, you can always follow us on Facebook and WYES.org. So have a great weekend and an even better week ahead. I'll see you next week for Wall Street Wrap-Up. I'm Andre Laborde. And remember, money never slips. Good night.
Sponsored by New Orleans Distillers, creators of fine spirits and liqueurs. Through dedication to science, art, and passion, blends of tradition and flavor emerge. For you, always locally crafted. New Orleans Distillers, classically Southern.